Okay, thanks, Larry. Okay, well, I'll focus in now on MDG 4, which is the target by 2015 of reducing child mortality by 2/3. And I suppose, as the name Save the Children implies, that goal ought to be fairly central to what we're about. And as I noticed to UNICEF, and I think we've had some really productive discussions already about the importance not just of reaching MDG 4, but reaching MDG 4 equitably. And increasingly been interested in the evidence that reaching it equitably gets you to that goal faster and more sustainably. So that's really what I want to discuss, and it's on the back of a report that Save the Children's produced, which we brought out yesterday, which was produced by some members of my team, some colleagues of my team, A Fair Chance at Life. Somebody said earlier, the Universal Declaration of Human Rights says that all people are born equal, but I think we know in this room that not all people live and die equal. And I think the simple fact that 99% of deaths amongst children below the age of 5 happen in developing countries, that those deaths overwhelmingly happen to children in the poorest households, should show us that equity is a central concern if we're to achieve MDG 4. It's a no-brainer, really. We know that the poorest children are disproportionately likely to fail to reach their 5th birthday. I think it's also worth saying at the outset that inequalities in child survival mirror wider inequalities in human development. So we're not going to tackle the issue of child survival unless we also tackle inequalities in some of the wider determinants of child survival. I mean, most obviously nutrition, where there are huge inequalities, and we know that nutrition is a factor in roughly a third of child deaths. But also maternal education, which is an enormously powerful predictor of whether or not a child survives to 5. And water and sanitation would be another area where the evidence is fairly strong that inequalities are very closely correlated in water and sanitation with inequalities in child survival. So we really do need to, I think, as was envisioned for the MDGs from the outset, recognise that these are interlocking goals and that inequalities in one area are going to impact on inequalities in all other areas. On to the question of inequities in MDG 4. Well, first of all, worth reminding ourselves that the MDGs were originally conceived as global targets, and it's very clear if we look at progress at the global level that it's been extremely uneven since 1990. As Richard was saying, and I think it's very important we do clock this, and to counter some of the pessimism about what's possible, there has been remarkable progress. And it's really important we learn from that. I think the problem has been that progress has been extremely uneven. So there have been hot spots of progress, and there have been areas where progress has been dismal, things have even gone backwards. So overall, we've seen a 28% reduction in child mortality since 1990. That's against the 67% that we would have needed by this date if we were to be on track to achieve the goal. And I think Africa is a particular area of concern, as Rich has already mentioned. So, you know, whereas in 1990 the child mortality rate for Africa was 3.5 times that for Latin America, today it's over 6 times higher than for Latin America. And those slow rates of reduction in child mortality for Africa, combined with rapid population growth, mean that the absolute numbers of children dying before their 5th birthday in Africa have actually risen since 1990. So whereas in 1990, 4.2 million children were dying before their 5th birthday, that figure is now 4.6 million. And we've seen a situation over the lifetime of the MDGs where African children have gone from accounting for 1/3 of child deaths to accounting for over 1/2 of child deaths. So increasingly, if we're going to tackle this problem at a global level, it is increasingly an African and a South Asian problem. I think it's also worth saying that within regions, including within Africa, we've seen very inequitable progress. So, you know, Kenya is a good example, you know, a country that has actually gone backwards despite having a fairly strong growth record, and being relatively wealthy by the standards of its East African neighbours, where if you go next door to Tanzania, we've seen a reduction of about 1/3 in child mortality since 1990. Not enough to get it to the target, it's not on track, but I think the contrast with Kenya is fairly instructive. You know, similarly, if we look at Bangladesh and India, we've seen, you know, India acquiring increasingly tigerish rates of economic growth, but it's done a very poor job of translating that into gains in child survival and well-being. So we've seen, you know, India achieving less than 50% reductions in child mortality since 1990, it's not on track. We've seen Bangladesh, in contrast, on track to achieve the goal. So I think it's important to clock as well that income levels and economic growth are not in themselves necessarily predictors of whether countries are on track in meeting this commitment. And then if we move to looking within countries, we again can see some extremely stark inequities. So, in India, children in the poorest quintile are 3 times less likely to reach their 5th birthday than children in the richest quintile. You've got not dissimilar ratios in Nigeria, about 2.5 times more likely that a child in the poorest quintile will die before they're 5 than a child in the richest quintile. And if we move to middle-income countries, where average mortality rates are often lower, and if you like, the residual challenge of tackling child mortality is increasingly concentrated in the poorest sections of society, then those ratios become even more extreme. So you look at a country like Peru, you've got a child mortality rate in the poorest quintile that's more than 5 times higher than for the richest quintile. So we're living in a world of some very stark inequalities in children's life chances. But I think what particularly worries us, and part of what motivated us in writing this report, is the evidence that those inequalities are in fact widening. So what we did is we looked at the available DHS data for the period since 1990. And it's available for 32 of the 68 countdown to 2015 countries. Those are the countries that together account for the overwhelming bulk of under 5 child deaths globally. So of those 32 countries for which the DHS data was available, what we saw was that in just 9 countries did we see equitable progress. Only in 9 countries did progress happen more rapidly amongst the lowest income quintile in terms of reducing child mortality than it did in the richest. And in 20 countries, we actually saw inequalities worsen. That's to say, the ratio between child mortality in the richest and the poorest quintiles widened. So a few examples, just unpacking that a little bit further. If we look at Ethiopia, Madagascar, Cambodia, Haiti, all countries that have made quite significant reductions in under 5 mortality. But if you look at what's happened in the smallest, in the poorest quintile, those reductions have been much, much smaller. Those poorest quintiles are way off track in terms of achieving MDG4. And if you then look at countries such as Rwanda and Burkina Faso, what we've actually seen is reductions in child mortality for the top income quintile. But then we've seen growing child mortality for the poorest quintile. So we've seen not just progress being disproportionately concentrated in the top quintile, but actually a total divergence between the life chances of rich and poor children. So one of the things our report does is we highlight the importance, given this data, of taking a differentiated approach to tackling child survival. Depending on where countries are in terms of progress towards MDG4, child deaths are likely to be distributed very, very differently between income groups, and also along other lines. So we do need to be kind of looking at rural-urban disparities, we need to be looking at regional disparities and so on. But as a general rule, I think it would be true to say, if we look at most low-income countries, what we've got is a pattern of mass deprivation. If we look at a typical sub-Saharan African country, in as much as there is a typical African country, child mortality rates tend to be very high for the bottom 60 or even the bottom 80% of the population in wealth terms. And what that implies is that we're not going to get to MDG4 simply through targeting the poorest. What we're looking at is a context in which universal access to a minimum package of publicly guaranteed services is going to be the only way that we're really going to start to make a significant dent in the challenge of child mortality. And I think in contrast, in a lot of middle-income countries, and in some low-income countries that have made very significant strides towards MDG4, what we're looking at is much greater concentration of child mortality in lower-income groups. So if you're looking at Latin American countries, some of the East Asian countries, the challenge is much more likely in those contexts to be one of targeting, because you're essentially dealing with a residual challenge. And that targeting needs to happen not just in terms of health service delivery. We're not going to achieve MDG4 just through healthcare. It needs to also be happening in terms of these other key determinants I mentioned earlier, and I think particularly in nutrition. So just to kind of start to wrap up, there are 4, I think, initial lessons we've drawn from the experience of countries that have combined progress with equity. And there were 7 countries that we looked at that had particularly done this, and we look in the latter part of the report at some of the policy lessons that are held, and I just want to enumerate those 4 lessons. First of all, that we do need to be tackling inequities in the wider determinants of child survival. Secondly, that we need a universal approach to service delivery, that targeting by itself will not get us the results that we need. That resources need to be delivered equitably, and that doesn't just mean financial resources. It's not just about public expenditure and about aid, it's about human resources, it's about technical resources, it's about the kind of interventions that are supported, need to be deployed in a much more equitable way than they are being at the moment. And that finally, transparent and accountable government is going to be much more likely to get us the equity-based policies that we need if we're going to achieve MDG 4. It's much less likely that governments will skew expenditures and neglect large sections of the population if you've a reasonably open political culture in which people's voices are heard and public services can be responsive. So I think, just to conclude, the lesson we want governments to draw from the current state of progress towards the MDGs is, first of all, progress is possible, even in the poorest countries, and that in many cases countries have really successfully combined equity with progress, so there's no necessary trade-off. We do need to better understand the policy lessons that lie behind these strong performers, and if we have any prospect of achieving the MDGs by 2015, it's absolutely imperative that come the end of this month, when world leaders gather in New York, they apply those equity lessons more widely. Thanks.